So cancer is such a name that brings fear to the bravest of people. But there is no hope without fear, and there is no fear without hope. And sharing hope and awareness in this hopeless condition with us is Dr. Manish Yadav. Dr. Manish Yadav is a well renowned homeopathic physician from Mumbai, practicing since about 14 years. He's visiting faculty at the Other Song. He has his own private practice at Meera Road. He heads the homeopathic setup at Vikhroli and also a consultant at the Cancer Center at Sadbhavna Trust near Tata Cancer Hospital. His zeal to treat challenging cases with homeopathy drove him to get training from many stalwarts in the field of homeopathy. He is very popular among homeopathic students for his inspiring way of teaching and sharing. He's an amazing mentor and guide to many budding homeopathic students and physicians across the globe. Amongst his patients, he's known to be a sound healer who's always available for help and guidance, as well as spreading positivity. He increases their confidence in the most difficult conditions we can come across. When I asked Dr. Manish how he manages to see so many cancer patients and deal with so many emergencies and acutes, he says, yes, it's a challenge, but someone has to take on the challenge and help the suffering people. And facing these challenges only makes our work worthwhile. So that is how Dr. Manish is. You won't ever find Dr. Manish without a book, such as his passion to keep learning new things and keep on advancing. He's an ardent student of the homeopathic science and of life. So without further ado, I would like to welcome my teacher, my mentor, and my big brother, Dr. Manish Yadav.
So thank you, Dr. Shazia, for this warm welcome. And welcome everyone. Today is 4th February, and we are talking about a day, like, celebrate. Generally, when we say a day, generally it comes as a celebration. We have anniversary day, we have birthdays. So when this Cancer Day was announced by the organization, or by WHO, I was thinking, why do they organize, or why do they say a day? Why do they want to celebrate? So actually, it is not about celebration, but actually it is about awareness. Of course, everybody in the platform right now and everybody all around the globe knows what this formidable disease is. And as Dr. Shazia was talking about hopelessness, I think this is one of the disease which brings a lot of hopelessness. So the question arises that in this hopeless situation, is there anything in the world which can even show a spark or maybe a small light towards a hope? So we are here together with a lot of information we're going to talk about and some patient testimonies. We'll go deeper into it and see if there's a hope and something we can be doing. So let me share my slide and I will begin and directly come to the point. Our entire purpose is to talk about there are different modalities, there are different therapies. Every therapy, every science has got its own limitation, advantages, and disadvantages. The purpose of the healing faculty, whichever science it belongs to, the purpose is to treat the humanity and to allay the sufferings of the people who are suffering from major diseases. So homeopathy is also one of a very mainstream science. It's been more than around 200 years and established in many countries. And right now, India is a hub, and India has got some great homeopathic doctors, literatures, and a lot of case studies you can find in India. So I'm really proud of it. So let's go ahead and see, does homeopathy has some hope with this dreadful disease? So before we go ahead, let us little bit understand about some aspects of this cancer. International Agency for Research on Cancer, WHO, India Source Global Scan 2020. This is the research paper that they produced. Number of new cases in 2020 for both sexes. So you can see breast cancer 13%, lipolar cancer 10%, cervix 9%, lung 5.5, colorectal 4.9, and it goes on, and other cancers around 56%, which is around 7,48,344. So total number of cases in 2020 was around 13 lakhs 24,413, which is a huge numbers. Number of cases in 2020, if only males are being scanned, Lip and oral cancer 16.2%, lung 8%, stomach 6.3, colorectal number goes on and on. And other cases around 3 lakhs. So total number of cases in male, the cancers around 6 lakhs. If we talk about females, the number list goes even bigger. So breast cancer around 1,78,000, cervix 1,22,000, ovary 45,000, lip oral 31, colorectal other cases, and total 6 means 6,78,000. So numbers are very difficult to understand. Like so many people suffering from cancer, and this is the data which has been taken diagnosed cases. There are so many cases which are not diagnosed. If you go in interior, there are so many people who are completely unaware of the disease even today. The medical facility and investigation has not reached to that level that every patient can be scanned. Still, these numbers are really worrisome. Total population of India around 1 Arab, 38 crore. Number of new cases around 13 lakhs. Number of deaths 85,000. And number of prevalent cases last 5 years 27 lakhs. Isn't these numbers give us scare? Isn't this number talks about that, the disease is a very dangerous one? Of course it is. If you really want to get a hands-on experience, just to get an experience, you should visit once Tata Hospital in Dadar, Lower Parel. You should just visit there, and when you'll go there, you'll understand what is the irony. Maybe we are sitting at our place, we have no idea what's going around, but there are so many sufferers. I've been practicing there at Sadbhavana unit, the trust, and people come from interiors. Oh my god. Even looking at their condition, they live on the roads, and so many difficulties, but still they come and they get the treatment, and still the disease remains uncured. Let's talk about some key factors very quickly. Okay. Cancer is the leading cause of death worldwide, accounting for nearly 10 million deaths in 2020, or nearly 1 in 6 deaths. So every 6 deaths, one person who dies is of cancer. Most common cancers are breast, lung, colon, rectum, prostate cancers. Around 1/3 of deaths from cancer are due to tobacco use, high mass index, body mass index, alcohol consumption, low fruit vegetable intake, lack of physical activity. Cancer causing infections such as HPV, human papillomavirus virus, hepatitis are responsible for approximately 30% of cancers in low and lower income countries. So when we are talking about deaths of cancer, of course, when the patient dies of cancer, that number is taken. But you know what? When a patient suffers from cancer and he goes through these harmful toxins and the treatments, whatever is available in whatever way, there is an opportunistic infections that come in because the immunity goes down. So many of the diseases like bacteria, the viruses, they tend to attack the patient. Maybe he's saved of the cancer, but what about the opportunistic infections that come in? So there are a lot of suffering and pain and difficulty in even deaths other than cancer, but other diseases, because it overlaps as the cancer engulfs the entire economy of human body. Many cancers can be cured if detected early and treated effectively. Yes, there is a possibility if detection is early and it can be treated properly. Definitely, there is a lot of hopes. Cancer is a disease in which some of the body cells, let's understand cancer. So it is a disease when some body cells grow uncontrollably and spread in other parts. So generally what happens in our body, there is a wear and tear mechanism going on continuously. So cells, they grow, they mature, they become old and die. Now the problem happens when this, in cancer generally, the cells after maturing and becoming old, they do not disintegrate, they do not disappear. What happens? They start multiplying. The dead cells start multiplying, and that is how tumors and the growths come in. So it is a mechanism, an internal mechanism where the system has to stop, but it doesn't stop and it speeds up. So natural process is happening. New cells are coming in. They are going in their routine, but the control of this cycle of growth, maturity, and then disintegration is not happening. So when the cells need to disintegrate, it starts multiplying even faster. And that's how disease happens. So cancer can start almost anywhere in the body, which is made up of trillions of cells. Okay. So you can't say that one place it is. What are type of cancers? One is benign. You can divide into two major categories. One is benign. What does benign mean? Benign means it's localized. Like you have a tumor, it's localized and it has not spread through the lymphatic glands and it has not spread other places. Metastatic, generally it spreads. You know, it spreads to the limbs. It starts maybe in uterus, it goes in lungs, liver, brain, anywhere it can go. Let's talk about the causes. The general causes, which is led by the conventional medicine, and few of them which we have understood after treating so many cases for decades. One of the major causes which I find out is, which I feel is diet. Now, is it under our control? I don't know actually, but yes, you all are aware that the foods that we are taking in, how much chemicals are being added into it. I just forgot the name of that place. There's a place in Punjab where a train comes to Rajasthan Cancer Hospital, and that train is given a name Cancer Train. So 10, 20 years before, there were no cancers in that place, but today we find that a lot of people around that area suffer from cancer. Why? Because last 10, 20 years, the use of insecticides, pesticides have increased rampantly. So this insecticide and pesticides which are being used, so the food that you and me are eating, we might buy it, with good quality looking at it, but everybody is aware the tomato that you're buying, the onion that you're buying, or any vegetable that you're buying, how much chemical can be induced in that. And also, other than that, the dietary habits that we have, the fast food and the burnt things that we eat, more free radical foods that we eat, this is also one of the main causes which can lead on otherwise to the formidable disease. Lifestyle. Oh my God. Look at the lifestyle that we have. Sometimes I feel so pretty, like, I feel, where are we running? Why are we running in life? Ultimately, everything is going to stop. A time is going to come when everything is going to halt. But the kind of lifestyle we have made, even when I look at myself also, there are times when I sit in my setup in my clinic for 10 to 12 hours. Morning I come and leave in the night. This is not right. Okay. So lifestyle is one of the biggest problem, means we have been not exposed to heat, sun, exercise, all those things are gone on the backtrack. Exposed to chemicals, very important. um, there are so many cases which come up when there are chemicals in water, there could be chemicals in the environment, or you might also be exposed to some chemicals which you are not aware of. You've been continuously eating that. Drugs. Everybody in today's world, they are very fond of drugs. When I say drugs, means not talking about the real cocaine and all drugs. I'm talking about the allopathic drugs, the drugs that you take in. I found so many people that they are so much inclined on popping the pills that even a little cold cough fever happens, they just want to pop in a pill. Little menstrual disturbance happen, they start on hormone treatments. They never go back, and even it's an information age, you can just click and watch out what are the side effects, what are the long-term side effects of taking any drugs that you're taking, any tablets that you're popping in. So these hormone tablets, these some analgesics that you're taking for a long term, maybe that could be also one of the causes, not only cancer, but there it could be causes of even other major diseases. So it has to be taken in control of. Addictions, of course, addiction like tobacco, alcohol, or any other addictions, there is a high possibility that smoking, it is written on the cigarette pack, dangerous. Even the gutka, it is written, it is so dirty. the pictures there, but still people eat. So that could be one of the cause. Oh my God, stress. What to say about this? On this panel, I want to ask how many people are stress free today? So the kind of stress that we have taken up, our goals, our imaginations, we want to run, we want to achieve, but the stress that we have, and that stress is not just financial stress or reaching towards a goal, but it also has a lot of emotional uphill battle that is going around, the relationship issues, all the things that goes around in you, day to day life, that has to be addressed. And of course there's an unknown cause. There are so many patients where the cause itself is unknown, the cause itself, and this area is huge. It is says causa effect. If there's an effect, there has to be a cause. If something is happening, like today, if I'm sitting here and talking to you, it means there was a cause. Like I worked on cancer, whatever I did in last 10, 12 years, 14 years, hence I'm sitting here. So there's a cause and effect phenomena with everything. So it cannot happen that a patient comes to you and there is no cause for it. And that's what we're going to talk about. Then in homeopathic practice, how do we find out the cause actually? Is there a hope? Is there a hope? The question is, okay, I understand, this all information is available everywhere. We understand, we are scared, we don't want to look at that. But tell me, doctor, is there a hope? So early diagnosis, early detection is one of the most important factor. Lifestyle changes. We all have to get aware about our lifestyle. There's nobody else is going to come and take a seminar and explain us. You know, we have to get aware of the lifestyle and we have to change our lifestyle, which is helping, or which is, if it is helping, you continue, but if it is not, then you have to change it. Stress management is so important. Somehow, which whatever modalities you can get your managed, your stress managed, maybe we might maybe later on talk about it, but I'm just giving you an idea. So much pressure that we have taken, so much emotional turmoils that we are carrying around, it has to be released, it has to be managed. Avoiding drugs. Once a patient becomes, a patient comes to me, and of course in homeopathy what happens, a patient comes and slowly slowly the entire family becomes your um, patient. My first sentence when he leaves my cabin or even in follow-ups is that please don't take allopathy or don't take any medicines. You give me a call at least. I will tell you which allopathy to take, but you don't take it, because I know that yes, the drugs which they can, take it, maybe there could be some harmful effects. I want to avoid it. So avoiding drugs, the first idea has to come in the patient's mind, the people's mind, that yes, I should not just run behind. Fever has come, so I'll pop in the pills. Throat infection has come, so I'll pop in the pills. Little bit, don't just rely on the tablets more and more. Get away from the tablets. In fact, get away from the medication if you really want to be healthy. And of course, homeopathy. Homeopathy is a science which can really help you if you're really eager to manage all these matters. Homeopathy can really help you. And let's see how it can. So now what I'll do is that not much talks, and today I'm really excited about this webinar. Why? Because I have got some of my patients, and I will not call them patient. They are my cancer warriors, and these people have come here, and they're going to share their testimonies. Few were on chemotherapy, and plus adjuvant therapy with homeopathy. Few were only on homeopathy. Different combinations. Few were for palliations. Few were for acute management. Different combinations you'll see here. So there were many patients, but yes, I selected few of them, and it is so nice that they have come on the platform and they're going to talk, share their experience. It's really going to motivate. I talk how much ever, it doesn't motivate, but a patient comes and says he took this, and this is the change, it can help. So the first case, I'll just show you the follow-up and I'll call the patient also. Luckily we have. This is a case of metastatic hepatocellular carcinoma. They came to us, and possibility was, of course, hepatocellular carcinoma with portal hepatic vein invasion with lymph node, lung secondaries, means it was liver, lung, even renal disease like kidney, ascites, lot of different organs. Means this is a case of metastasis. And the condition when I saw her was really difficult. And I managed, I was able to manage this case with my guru, Dr. Sunilmar Sarkar, with his guidance and with his help. We managed this case. So advanced hepatocellular carcinoma, diabetic ketoacidosis, acute kidney injury. So these are reports after the treatment. So we can see basal lung shows good resolution with complete recovery. Only tiny ones are seen in the left lower lung. And this report is of 2014. So in 2014 or 15, we had seen this patient. And this is another report of the kidney, because kidney was also affected, and it says no focal lesions in the liver. So what I would like to do is that I would like to call directly our cancer survivor number one. Namaskar, how are you?
I'm doing fine. So
My God,
happy to be here.
you've gained weight, huh?
Yeah, little bit,
Yeah.
little bit.
It's been a long time. Actually seeing you.
I think almost after 5 years, 7 years.
2015 was the last treatment we
Yeah,
saw.
yeah.
Can you just brief about you and how are you doing? And
Yeah, the moment I saw on the screen the Vadamalian, I could identify myself. It's been a very long journey, and I'm very happy to be with you all here. It was in 2014 that I was diagnosed with liver carcinoma. And even it was all a shock to us because we weren't knowing what it is and things like that. Just prior to my final diagnosis, it was like the whole 1 month, I was just lying down, sleeping, and not able to eat anything. Then I was diagnosed with that. Then at the Vadamalayan hospital, they did not give us much hope. It was kind of told to my family that perhaps she may live for 3 months. And after that, whatever each day is a bonus to your family. Now, here I just want to mention one thing, that prior to this 2014 episode of mine, just 5 years prior to that, our entire family had given up chemical drugs. That means allopathy drugs. Because I am a diabetic since 97 and it wasn't helping. So our understanding was, if I am taking some treatment for cure, it has to get cured. If it is not helping. So as a family, we gave up the chemical drugs. So this, when I was diagnosed with this cancer, a friend of mine who came to know of it, she volunteered to refer me to the other song. It was so nice of her. So she collected all my reports and she gave it to Dr. Sarkar and Manish. I'm very, very happy to be associated with Dr. Manish and Sarkar. And it is so surprising that without meeting them in person for about 3.5 months, we were just on Skype call. And, they were very, very empathetic in understanding the issue. We realized as a family that there is a lot of difference between the allopathy treatment and the homeopathy treatment. In the homeopathy treatment, I find the medicine part is very, very minuscule. What is more required is your psychology and your wherewithal to handle the mental stress of it, which was very well taken care by other song. I am very, very thankful to that, sir. You were you are going to the root cause as to understand the fear level, to understand the conceptual level of what a disease is and how it needs to be handled, not only by the patient, because here it is such kind of major diseases. The role of the family is also very important. The role of your friends, what kind of a support, whether they are giving you hopeful support or they are resigning themselves to the feeling that, oh, no, there is no cure for it. It is a gone case. As a quiz, even if you happen to hear such things, then even your morale will go down. Here, what I found in other song is You are so very empathetic, very, very understanding. You want to go to the root cause of it and very patient. Normally, even allopathy, whatever be the doctor, they don't take more than 5 minutes. Here is a person, here is the system where people are willing to sit with you for hours to understand our problem, patients' problems, and come out with solutions. And one fantastic thing is your telephonic talks, they are all available on the phone. And secondly, your Skype calls. Even if we just message, at any time, I'm having the liberty to call you to explain my situation, because that is the relationship that we share. Something similar to olden days where we used to have a family doctor. He knows about our entire family history, not only about disease, about other things also. So this kind of a relationship really enhances the trust of the patients who are coming. I am very, very happy you have provided us. I decided to, other song really gave me, I want to tell my audience that I had suffered a cancer, and for nearly 25 days, I could not pass stool. This I kept telling Mr. Yadav and Sarkar, and they used to ask me for a feedback of my mental feeling, my physical feeling, and keep prescribing medicines for 2 days and for 3 days. And depending upon the feedback that I give, they used to change medicines. And it was a very, very great boon that I came in association with you. And today I am alive. I am alive with my family. It has been almost now, it was 8 years. God has also blessed me with good life, with my staying. I resigned my job, stayed with my old parents, took care of them. And, it was, my parents were suffering when I was suffering. My mother and my father, so being very religious and spiritual, they used to sit and do prayers for hours. And I am happy they saw me live a very, very normal life. And second, I want to say I started taking your treatment in May 2014. And by August, I came in person to meet you all in Bombay. In person, without any physical help from others. I walked into your cabin, I met you all, then I met you a couple of times. Then again, of course, I did have some bouts again after 3 months, 4 months, but that was all handled by you people very well because of the communication channel that you have created. That communication channel of your Skype and your SMS or WhatsApp and the video call and telephone call really, really makes the patient more comfortable. That is very, very nice of you, sir. I am very, very thankful to the Other Song Academy for it. Very, very thankful. I did stop my medication due to my own personal reasons that I am unable to take medicines on time. And then I just shifted to acupuncture, which I was doing. Now acupuncture also I am not taking. God is giving me, continues to give me good energy, and with blessings of you people, I am surviving, doing very well, sir. Thank you so much. The Other Song, very, very much, very much.
Thank you, Lalita ji. You are an inspiration and you are a strong lady. You fought the battle and we won. Actually we won, and
yeah, it
I'm
is
so
not
happy.
I1. You have written I1. It is not I. It is V1.
It is V1. Yeah.
Yes.
It is V1.
Yeah.
So God bless you. And I know you have an entrepreneurship now. You're an entrepreneur. You have your business set up, and you are expanding with your own family. So keep on moving on. And anytime you need any help, assistance from us, we always there.
Thank you.
And your reference, who gave you reference, Vasumati ji, is also online. I saw her name also somewhere.
Okay, I would like to meet her at least through this. We don't find time.
Not now. Maybe we have to finish this video call. But yes, definitely we can connect sometime.
Okay. Thank
you. So thank you very much.
Thank you,
Vasuji. Thank you. This is another case, case of seer rectum. He's also our second cancer survivor. So let me give you a brief history about this patient. Patient came in around 2016. So he had actually started a treatment with us, but at the same time he went to the conventional side and he was also taking medicine there. So what happened with him? Surgery was advised, but patient decided that I do not want to go ahead with it. Chemotherapy was given for 1 month, but the chemotherapy side effects was so bad that he said, I will not take it. I mean, he was not able to take because the drugs produce lot of side effects. So surgery is out, chemo is out, but they have to do something, right? So patient was unwilling, not willing to take chemotherapy drugs because of side effects. So what they did, the other thing, after surgery, chemo, radiation. So they advised, okay, you maybe take radiation, maybe something can happen. So he took 25 radiations. After doing all those things, so for this brief period, he discontinued medicine from us because he was in pain and agony, and somehow communication was not being able to establish. After all these intervention, condition remained the same. There was actually no change in his suffering. In fact, the patient's suffering was increasing day by day. And that was a time when again we got connected, and there was no hope for his cure. We started with him the homeopathic treatment, and this is his video follow-up. We have all his reports. He's completely stable. In fact, this is a video which I recorded after he stopped the treatment and he went to Dubai for his work. So when he came back, that was the time when I recorded this video. So let me play this video and show you.
So बताइए खादर जी कैसे हो?
अच्छा हूँ सर।
कितने दिन के बाद आ रहे हो अभी?
अभी मैं 6 मंथ वहाँ था, मम्मी की तबीयत खराब होने की वजह से 1 मंथ लीव पे आया।
कहाँ पे?
सऊदी मक्का में।
अच्छा, वहाँ पे जॉब कर रहे हैं?
जी जी।
तो मेडिसिन डिसकंटिन्यू करके कितना दिन हो गया अभी? अभी तो बंद कर दी ना मेडिसिन?
नहीं, छोटा ड्रॉप काजी डॉक्टर देते हैं बस।
वो ठीक है, बट यहाँ से तो अपना बंद है ना मेडिसिन? तो कितना दिन हो गया अभी?
तकरीबन 2 साल।
2 साल हो गए ना
जी।
तो ये 2 साल कैसा रहा आपका?
अच्छा रहा सर, कोई प्रॉब्लम नहीं रही।
तो आपका मेन कंप्लेंट बताएंगे क्या था, किस लिए आप आए थे?
मेरा ब्लीडिंग होती थी, हर जगह गया था तो पाइल्स बोल के काफ़ी वक्त ऐसे ही निकल गया। जब लास्ट में क्लोनोस्कोपी किया, जब भी पता लगा कि कैंसर है करके।
सी रेक्टम।
फिर आप लोग से 1 साल में दवा किया, उसमें क्लियरेंस हो गया, पैट स्कैन, MRI सब किया। लास्ट वो पैट स्कैन करके आपको बताया था।
हाँ, तभी आप आए थे।
जी। उसके बाद मैं कतर गया, फिर इंडिया में जॉब किया, फिर अभी सऊदी में।
वेरी गुड, वेरी गुड। तो ये होम्योपैथी से क्या क्या बेनिफिट मिला आपको?
बेनिफिट तो सर बहुत मिला गया, रिलैक्स मिला। जैसे टेंशन, मतलब दिन ब दिन रिकवरी होते गई तो मुझे भी खुशी महसूस होती गई कि भाई रिकवर हो रहा है। पहले तो ट्रीटमेंट किया तो कोई फर्क ही नहीं था, वही सेम प्रॉब्लम, ना कम ना ज्यादा।
पहले आपको ब्लीडिंग हो रही थी ना?
जी।
ब्लीडिंग एंड दर्द भी हो रहा था?
नहीं, दर्द नहीं था।
पेनलेस ब्लीडिंग होती है?
पेनलेस ब्लीडिंग।
बट ब्लड बहुत जा रहा था?
जी जी। 7 पॉइंट से भी कम हो चुका था ब्लड।
HB ना आपका?
जी। और जब मैं टाटा में पूछा तो 3rd स्टेज बताया था।
अच्छा, टाटा में ना?
जी।
वेरी नाइस। सो खुश हो अभी?
जी सर। जी सर।
Very nice. We are also very happy for you.
So I'll move quickly and show you a few more cases. There's another case. This was a lady who came in 2017 or something. 61 years of age, old female. She also had a tumor in her rectum, and they did a little laparoscopy in that, but that complaint was still subside. It has not subsided. The complaint was increasing, and that's how they came to us. And very less time, the remedy was given, understanding all the condition, and beautiful recovery. It's being more than, I think, 2016, 17, so many years. So I couldn't get that lady on the board, but his son, because the lady is very old and stays in a rural village. In fact, I have only seen her twice, and other than that, only on video call or phone call consultation. So I could get her son, and the son is talking about the role of homeopathy and what he received from it.
तो मुझे लगता है हम दिसंबर में आए थे 2016 में आपके पास। ओके, सो इनिशियली इट डायग्नोस्ड एज रेक्टम। ओके, रेक्टम टाइप का था वो, और गैलेक्सी हॉस्पिटल में हमने किया था उसका ऑपरेशन करने के बाद आई थिंक विदिन 15 डेज हम आपके पास आए थे कि भाई ये तो अभी ऑपरेशन हो गया है, लेकिन आगे हमें ना केमो चाहिए ना रेडिएशन चाहिए। ओके, तो हमको क्या चाहिए आगे, ये अगर होगा ग्रोथ उसका वही का वहीं रुकना चाहिए, फ्यूचर में कभी उसका प्रॉब्लम नहीं होना चाहिए। तो दिसंबर 2016 में हम आपके पास आए, तब से आज तक मुझे लगता है कंटिन्यूअसली हम आप जो भी मेडिसिन देते हो फॉलो करते हैं। और सबसे इम्पोर्टेंट, आपने जो भी हमको बोला है, मेरी मम्मी को, ये खाना नहीं है, मतलब दूध नहीं लेना है, शुगर नहीं लेना है, चाय नहीं लेना है, जो भी आपने जो बताया था उनको, वो आज तक उन्होंने 100% उसको ये किया है, 100%। और इसलिए मुझे हमें भी इतना कॉन्फिडेंट था कि ये 100% आपने जो बोला, और आपने बोला इसलिए उसने माना, हम अगर बोलते तो नहीं मानती वो। इसलिए हम आपके पास लेके भी आए थे ना उस टाइम एक बार,
राइट,
आपने जो
सेम
बोला
थिंग।
उसने माना। और मेडिसिन भी वो खुद बोलती है। मैं अभी लास्ट वीक ही मुझे कॉल आया था, मतलब मैं कॉल किया था ना कि मेरा अभी एक हफ्ते का है, मुंबई का आपके डॉक्टर को फोन करो और बोलो भेजने के लिए। तो मेडिसिन और वो आपने जो बोला था, जो खाना है जो नहीं खाना है, वो दोनों उन्होंने तंतोतंत मतलब उसका पालन किया। और अभी 6 साल हो गए, कभी ना हमने कभी सोनोग्राफी किया, ना कभी उसको बाकी कुछ किया, कुछ कुछ प्रॉब्लम नहीं, कुछ कभी मुझे लगता भी नहीं कभी बीमार पड़ी हो, एकदम तंदुरुस्त है। और ये आपकी वजह से हुआ है। और मैं भगवान से प्रार्थना करता हूँ कि आपका जो ये चल रहा है कार्य, मतलब है उसमें होम्योपैथी में इतनी कैपेबिलिटी है, और हमको बिलीव करना चाहिए एक्चुअली। ऐसे नहीं है कि बाबा क्या है, तुम जब बिलीव करोगे तभी तुमको रिजल्ट मिलेगा ना। और मेरी मम्मी को अभी पता भी नहीं एक्चुअली, ये पता भी नहीं है
उनको बताया
क्या
नहीं था
डिसीज था
आपने?
क्या है। हाँ,
हाँ,
नहीं नहीं अभी तक नहीं बताया है।
आई थिंक 61 का
और
एज था।
अभी
61 व्हेन शी
65, हाँ
अभी
हाँ
65
उनको हो
होगा,
गया तो
6 साल हो
61।
गए। हाँ।
अभी 67 साल है। कभी भी कुछ भी तकलीफ नहीं है, कभी थोड़ा बहुत कुछ खांसी या कुछ बुखार आता है तो आपका जो दवाई के साथ जो वो लेती है, पेन
SOS।
किलर बिल्कुल भी नहीं लेती, पेन किलर बिल्कुल,
अच्छा,
मेडिकल का
पेन किलर,
बाहर का कोई भी
पेन किलर तो
नहीं।
वो 25 साल की एज से ले रहे हैं ना, 22 साल की एज।
हाँ, पेन किलर
बहुत
लेती थी
पेन
ना वो
किलर
गाँव
खाती
के।
थी।
हाँ, गाँव को में वो प्रॉब्लम होता है ना,
हम्म।
मेडिकल पास में रहता है, तो कुछ दर्द होने लगा जाओ पेन किलर, मतलब वो सिर्फ बोलते हैं कि मेरा दर्द हो रहा है गोली दो, तो वो पेन किलर रहती है। ठीक। तो क्योंकि क्या है, मेरे डैडी का जो डेट हुआ था ना, वो भी उसके कारण, उस टाइम हमें उसमें नॉलेज नहीं था। और इसलिए हमारे डैडी को हमने गवा दिया था। तो जब हमारा मम्मी का जो हमें पता चला ना, इसलिए हम बहुत सतर्क हो गए। हमें पूरा नॉलेज था क्या है डिसीज, उसको क्या करना चाहिए क्या नहीं करना चाहिए। इसलिए ऑपरेशन में हमने वो लेप्रोस्कोपी से किया, एक दो मतलब टाका उसको स्टिच पड़ा था, वो भी 8 दिन के अंदर ही उनको मिले था, डिस्चार्ज मिला था। लेकिन तुरंत डिस्चार्ज मिलते तुरंत 8 दिन में हमने डिसीजन लिया, और हम आपके यहाँ मुंबई में उसको लेके आए थे ना। तो 6 साल से हमने ना मेडिसिन में कभी वो देरी कर दी, ना उनके खाने पीने में, मतलब खाने में कुछ भी खा सकते हैं, लेकिन जो नहीं खाना है वो उसने पालन किया। आपने जो बोला था उसको, तो मुझे 5-6 चीजें थी आपने जो बोला था उनको नहीं करना है, उसने बिल्कुल नहीं किया। और उसकी वजह से तो उनकी लाइफ बढ़ गई। और नॉर्मल, एकदम नॉर्मल, ना उसको पता है ना बाकी लोगों को पता है उसको कुछ हुआ था भी, इतना एकदम नॉर्मल है।
वेरी गुड।
उसके बाद कभी हॉस्पिटल भी नहीं गई है, कुछ भी नहीं है,
वो
एकदम
ब्लीडिंग
खाना
वगैरह
पीना।
सब,
हाँ,
ब्लीडिंग वगैरह तो बंद हो गई थी ना, वो थोड़ा
पूरा
ब्लड।
पूरा पूरा, हाँ, पूरा कुछ भी नहीं। मतलब वो क्या उसकी पूरा ये नहीं था ना, मतलब जो टाका उन्होंने डाला डॉक्टर ने, उसको एक 15-20 दिन लगा था वो सूखने में, लेकिन वो भी हो गया। उसके पहले हम आपके पास आए थे ना।
फील हो गया।
तो डेफिनेटली 100% इम्पैक्ट है आपके इसका, और हमें भी कॉन्फिडेंट है, और मेरी मम्मी को भी कॉन्फिडेंट है, और मेरे जो भाई वगैरह उनको भी पता था एक्चुअली क्या है, तो उनको भी कॉन्फिडेंट था। क्योंकि अभी 6 साल हो गए कुछ नहीं हुआ है, मतलब 5 साल के बाद तो मैं तो एकदम ही ये हो गया, फ्री हो गया था। लेकिन जब तक है तब तक उनको कंटिन्यूस मेडिसिन चालू करता रहूंगा, और ये जो भी आपने बोला है उनका, ये खाने का चीजें पीजिए उसका ध्यान रखूंगा। तो डेफिनेटली,
नहीं, वेरी नाइस
मतलब मेरे
आपका।
पास अगर कोई ऐसा आता भी है हमारे पास ना, तो डेफिनेटली मैं रिकमेंड वही करता हूँ कि बाबा आप केमो या रेडिएशन, अगर डॉक्टर बोलते हैं नहीं जरूरत है, नॉर्मली फर्स्ट स्टेज में बोलते हैं वो लोग ना कि तुम्हें जरूरत नहीं है केमो और रेडिएशन की, वो अच्छा है, नहीं है तो नहीं है, ठीक, लेकिन उसको सप्लीमेंट्री तुमको ये करना है, होम्योपैथी के पास जाना है, और उनके पास ये तुमको दवाई और जो तुम खाने पीने का जो है वो सचमुच उनका पालन करना है। 101%, मेरे केस में तो 100% इम्पैक्ट हुआ है।
वेरी गुड।
मतलब 65 एज के बाद तो मतलब ये तो बहुत ही है ना उनका पहले। और मेरे वहां तो इतनी वीक है, कोई बोलेगा तो देखेगा कि मतलब क्या खाते है कि नहीं, इतनी वीक है, फिर भी उसने वो सस्टेन किया, और एकदम हेल्दी लाइफ अभी भी
एक्चुअली
मतलब
मुझे याद आ रहा है
जी
ना,
रहे।
वो जब आए थे तभी, वीकनेस है एक तो, एज फैक्टर भी है उनका,
यस
तो
यस
इसमें
डॉक्टर,
कॉम्प्लिकेशन
बहुत वीक,
बहुत बढ़ जाता है।
बहुत बढ़ जाता है, बराबर।
चलो बहुत अच्छा है। अर्जुन जी, आपने जो एक वीडियो दिया है ना, ये बहुत यूजफुल होगा,
हम्म
ताकि हम और लोगों तक ये अवेयरनेस को क्रिएट करें. एंड वी रियली थैंकफुल कि आपने टाइम निकाल के ना यू केम अप एंड यू.
यस यस. नहीं, आपने तो मेरी मम्मी की लाइफ वापस दी थी. और ओनली लाइफ नहीं है ना कि अब जितना नॉर्मल आदमी जो जीता है वो लाइफ है, उसको खुद को भी पता नहीं है हमको कुछ 5 साल पहले कुछ हुआ था, कुछ नहीं, इतना नॉर्मल है ना वो लाइफ. So that's big thanks for you and your efforts, and all the best for your this new clinic opening. Okay, thanks.
Thank you. So let's see one more follow up, and this is the case another cancer survivor. What she has to say.
जी, मैं भी उन लोगों में से एक हूँ जो कैंसर से लड़ चुकी है और इसमें होम्योपैथी का बहुत बड़ा हाथ रहा है. होता है ऐसे कि जब हमें कोई जानलेवा बीमारी हो जाती है तो हम इलाज तो शुरू कर देते हैं, लेकिन उसके बारे में सोच सोच कर डिप्रेशन में चले जाते हैं और इससे दवा असर करना कम कर देती है और हमारी बीमारी बढ़ने लग जाती है. तो होम्योपैथी की दवा लेने से हमारे दिलो दिमाग को सुकून रहता है और हमारा इलाज बहुत आसान हो जाता है. जब मैंने पहली बार दवा ली थी तो मुझे लगा था होम्योपैथी की इतनी छोटी सी गोली और सिर्फ 4 कैसे असर होगा, लेकिन जब मैंने वो दवा ली तो मुझे पता चला कि कितना आसान है इलाज कराना. और बहुत से लोग ये भी सोचते हैं कि होम्योपैथी की असर बहुत लेट होता है, लेकिन ऐसा नहीं है. जब कीमो चल रहा था मेरा तो एक बार अचानक रात को आँख खुल गई और मेरी सांसें उखड़ने लगी. मैंने सोची बच्चों को क्यों परेशान करूँ, थोड़ी देर में ठीक हो जाएगी. 15-20 मिनट तक जब ऐसे हो गया कि मुझे ऐसा लग रहा था बस अभी सांस तो रुक ही जाएगी, इतनी सांस फूलने लग गई थी. फिर मेरी बेटी को उठाई तो उसने बोला मम्मी आप क्यों इतनी तकलीफ़ ले रहे हो, होम्योपैथी की इमरजेंसी ऐसो दवा डॉक्टर ने दी है आपको. फिर डॉक्टर को फ़ोन करके सिर्फ 4 पिल्स मैंने ली और कुछ सेकेंड में मुझे आराम मिल गया. तो ये होम्योपैथी की दवा बहुत अच्छा असर करती है और मुझे तो इससे बहुत फ़ायदा हुआ है और हर बीमारी में ये असरदार है. इसके लेने से बीमारी बढ़ती नहीं है और जबकि जो बीमारी ठीक हो गई दोबारा होने के भी इसके चांसेस नहीं रहते. इससे ज़िंदगी भी बहुत आसान हो जाती है और इलाज भी बहुत आसान हो जाता है.
Okay, now let's go very fast, quickly, with some recent cases, 1 or 2 cases, and then we'll jump to the live testimony of the people who have come with us, the cancer survivors with us. It's a very recent case, and I want to show this case, and through this case, I want to share something very important, which you should know, everybody should know. And if you understand this phenomena, it will be really helpful for you in many of the diseases, and you can understand the body, mechanism, how it works. So this is the case of CL lung and brain metastasis. So this patient is already in cancer, like Tata Hospital. The treatment was going on. Radiation was given, oral chemo was given, that's it, and no other treatment. So when he came to me, that treatment is already over, okay, but his life is not that great. Like he has weakness, coughing, which started with the trouble, has not gone. Many complaints were there. So to cut the story short, I'm not going into the analysis of the patient. Maybe we can talk later when we talk to the doctors. We gave the medicine and see what happened after the medicine. That's what I want to show. So how does body heal? You have to know about this. So listen to this patient carefully. Just a few minutes he is going to talk. So after giving medicine, अनिल जी, अभी हमको 2 महीने हो गए ना ट्रीटमेंट को, है ना, यहाँ पे. तो बताइए ना आपको कैसा है, क्या क्या चीज़ में आपको फ़र्क है, नहीं है, क्या क्या बताइए.
मैं पहले से एकदम स्वस्थ हूँ, अभी कोई प्रॉब्लम नहीं मुझे, खाली बैक पेन का ही प्रॉब्लम है,
जॉइंट्स का थोड़ा सा पेन,
जॉइंट्स का. और अभी वो भी मतलब ज़्यादा देर बैठेगा तो पहला ऐसा बैठ आधा 1 घंटा बैठता तो पेन करता था, लेकिन अभी ऐसा नहीं है.
तो उसमें भी थोड़ी राहत लग रही है आपको?
हाँ.
अच्छा, और जब आए थे यहाँ पे तो क्या क्या दिक्कत थी, फिजिकली क्या क्या तकलीफें थी आपको?
पहले तो अभी जैसे मैं टिटवाला जाता हूँ मेरे घर पे, तो उधर जाने में मैं थक जाता था, आने जाने में ही.
अच्छा,
लेकिन अभी वो नहीं होता पूरा.
अब वो प्रॉब्लम नहीं है. अभी जा रहे हो टिटवाला?
कल जाके आया, आपका दिन वहीं था।
अच्छा, ठीक था।
हाँ, मतलब मेरे भांजे को लेके, मैं ड्राइव करके नहीं जाता हूँ,
अच्छा,
तो भांजे को लेके गया था। सोमवार को जाना था, तो कल इस संडे को चला गया। मैं ट्रैफिक नहीं रहेगा, चल जाते हैं।
वेरी गुड, वेरी गुड। और आपको खांसी वगैरह भी थी ना जब आए थे आप? बहुत
हाँ,
खांसी होती
खांसी थी, अभी नहीं है।
तो खांसी में क्या होता था दिक्कत आपको?
खांसी में गले में थोड़ा खराश रहता था।
कॉन्टिन्यूस कॉफ था ना जैसे? अनिल जी, और जो वीकनेस वगैरह थी वो कम है आपकी?
हाँ, अभी कम है।
बाकी
चलने में पैर इधर उधर होता था, वो भी अभी अभी समझ में नहीं आता, नहीं होता है।
नहीं, तो कहने का मतलब जनरल हेल्थ अच्छी है आपकी?
हाँ,
हाँ?
हाँ।
और दवा लेने के बाद, जब फर्स्ट टाइम मैंने दवा दिया था तो आपको लूज. So listen to this carefully. What happened? His actual disease, the cancer, started with cough, and there was a specific cause for this cough, which was not understood. So the treatment went by, but his symptom remained the same. His disease never changed. So after homeopathy, his cough and general health, everything got better. But just as I gave the medicine, the next day, this is what happened with him. स्टूल हुआ था ना?
हाँ, बहुत बहुत भयंकर।
तुरंत हुआ था ना दवा
हाँ,
लेने के?
हाँ।
कितने दिन रहा लूज स्टूल?
2-3 दिन, 2-3 दिन पेट एकदम पूरा नरम हो गया, खाली।
अच्छा,
उसके बाद अपने आप बंद हो गया।
दो 2-3 दिन कितनी बार हुआ लूज स्टूल दिन में?
तो दिन में 3-4 बार हुआ।
3-4 बार हुआ। और उसके लिए कोई दवाई तो नहीं दी थी आपने?
नहीं, नहीं।
है ना? आपने कॉल किया था मुझे, मैंने कहा अभी
हाँ।
उसको रहने दो, अपने आप सेटल हो गया।
हाँ,
हाँ सर, आपने बोला जो दवा आप ले रहे हैं
हाँ।
वो बंद कर दीजिए।
हाँ।
फिर उन्होंने बंद किया, फिर
तो अभी इनकी हेल्थ कैसी लग रही है आपको?
अच्छी है सर।
अच्छी है क्या?
पहले जब यहाँ आए थे तो 62 था वजन, अभी तो 74।
74 हमने देखा ना, 74 के. So I am very optimistic with this patient. I'm very optimistic. Now what happened with this patient was, after giving the homeopathic medicine, diarrhea started. So toxins, the idea that I want to put forth here is that body always wants to throw toxins. The best doctor in the world that you have is your own body. Sometimes we underestimate it. So the discharges that are coming out of your body should never be stopped. That's the number one thing. And we as a homeopathic doctor get really excited if after giving the medicine, something happens, like discharges happen. Toxins have been thrown out, like urination increase, perspiration increase, coryza starts, your discharge starts, diarrhea happens. We know that the recovery is going to be really good. So the point which I want to emphasize is, please do not suppress your diseases. Get to a natural therapy. Forget about cancer, but even in day-to-day practice, day-to-day, you get some diarrhea, pain, something. Don't suppress the disease. Let the disease come out. And homeopathy can be a really effective mode of treatment in doing that. Because those things, when they are suppressed and stopped, disease goes inside, and you have no idea whichever the weakest organ that you have is going to be attacked, and the disease is going to come in. I have many things to talk about, but we have a time constraint. Like in this case itself, as the acute management is very important. Now, for homeopathy, people always say that it is very slow. It is very slow. I can show you cases, fever, pain, XYZ acute cases getting cured within a day, or within 1 or 2 days, or within even hours. That effective homeopathy is. The same patient, after last week, what happened? He got chorea. You know chorea? He got twitching of the hands. Sudden twitching happened, and it's twitching, twitching, twitching. Hand is twitching. It's called chorea. He went to Tata again. They what the medicine what they gave was steroids. Now steroids, I don't know. Steroid is not a medicine, right, to be given, but they have nothing else. So give steroid for 2 days, and they said take it for 2 days and stop, because they know who are giving the medicine, they know the side effects and hazards of it. After that, he came to me. The remedy was analyzed, and after analysis, the remedy, whatever I gave, it just took 1.5 days to 2 days, and the entire chorea subsided. I have an audio recording of that, but I'll not go into it because time is little less. This message is very simple, that in homeopathy acute management, when we talk about, especially even if you're looking for your patient as a palliation, or some symptoms get aggravated, homeopathy works wonders. only thing is you need to connect to some good doctor who sits with you, analyzes the case, and gives the right remedy. So now we have here many of our cancer warriors. We saw few of them. So we have few of them live here. So like now I would like to invite one by one everyone. So first I would like to invite Bela Shah. Can you please share your experience with homeopathy and since when you were diagnosed and everything, whatever you would like to talk.
Yeah, sure. I've been diagnosed with cancer in 2015, January 2015, and I had to undergo chemotherapy. And parallelly, I had come in contact with Dr. Manish and Dr. Sunirmal Sarkar at the other song. So it was a great experience with them. I had undergone chemotherapy, and Dr. Manish used to always give me 3 days ka medicine prior the chemotherapy. We all know that chemotherapy की जो side effects है, they are very dreadful. Means diarrhea हो जाता है, vomiting होती है, ये सब side effects होता है. And suppose मेरा chemotherapy कल है, so before 3 days, Dr. Manish used to tell me that you take these medicines before 3 days. And I used to take these medicines, and it was wonder only that मुझे कभी भी diarrhea नहीं हुआ, कभी भी vomiting नहीं हुआ. I was never feeling any weakness due to chemotherapy. And घर पे आके I used to directly start working. I had 2 kids, means my daughters were very small. So I directly started working. ऐसा लग ही नहीं रहा था कि I'm undergoing such a treatment that chemotherapy मेरा चल रहा है. I was living my life as normally as I always do. So that was a great benefit of homeopathy medicine. And Dr. Sarkar and Dr. Manish told me to minus some things from my diet, that is milk and sugar. That till date, I'm not taking milk and sugar. That it has been 8 years. So completely I have left it. And with that, all the there's biscuits and chocolates and जो भी preservatives वाला आता है, color वाला आता है, all these things I've stopped. एंड मैंने एक बार पूछा था डॉक्टर सरकार से कि डाइट में मुझे क्या ध्यान रखना है, तो उन्होंने एक ही सेंटेंस बोला था कि ये लो वो लो कुछ नहीं, टेक ऑल नेचुरल थिंग्स. दैट वाज द ओनली सेंटेंस दैट ही टोल्ड मी. सो टिल डेट आई एम फॉलोइंग दैट. जो भी नेचुरल है वो सब खाओ. और मिल्क की ऑल्टरनेटिव मैंने पूछा था कि मिल्क, बिकॉज मिल्क वी नीड इट. तो उन्होंने बोला कि यू टेक पनीर लीजिए, कर्ड लीजिए, बट स्टॉप मिल्क. सो दैट आई हैव स्टॉप्ड कंप्लीटली. And actually now for homeopathy, I've said 2 words that they are magic pills. It's not a medicine, they are magic pills. Because not only with cancer, but आज मुझे कुछ भी होता है, simple headache होता है, या कुछ sunstroke आ जाता है, कि कुछ भी normally होता है, तो directly मैं डॉक्टर मनीष को, डॉक्टर मनीष ये हो रहा है, and he tells me ये SOS ले लो, and within few hours or within the next day, it starts the effect, means I'm completely fine. So I don't even prefer to take crocin, not even crocin. और कोई एलोपैथी तो सवाल ही नहीं है. Not even crocin I would prefer to take, because SOS medicines जो हमेशा रहते हैं हमारे पास, I would कहीं पे भी मैं बाहर गांव भी जाती हूँ तो always carry the SOS with me, कि नहीं कुछ भी हुआ तो I'll call Dr. Manish and he'll tell me and it will be cured. मुझे एक भरोसा बैठ गया है कि क्योर होने ही वाला है. That is the thing. And to all the patients over here, I would like to suggest कि आपका जो भी treatment चल रहा है, definitely you go with homeopathy with it, and it will surely show the result. I am the live example of it, because मुझे जब पहले पता चला था तो it is such a dreadful disease, and it is really so scary कि हमको सीधा death ही दिख रहा है कि now I'm going to die. That is the only thing. But I am the example that I can say cancer can be lived. And it is with homeopathy you can live cancer, and with in a very nice way. I'm living my life very nicely, very very nicely. Means जो लोग मुझे जानते हैं, they take me as an inspiration, that you are an inspiration for me, for all of us, that you are living such a good life. So and जो भी homeopathy medicine आप कर रहे हो, do it with faith. That is the main thing, that do it with faith, that it will definitely cure me. Because without faith, I think any medicine won't work. So very hopefully and very faithfully, and जो भी डॉक्टर बोल रहा है वो उसको properly follow करो, and it's definitely going to work. And it
Thank
has
you. Yeah.
also,
Hmm.
it has
Yeah,
also
please,
helped
please.
me in developing my immunity. और कुछ भी ज्यादा अभी मुझे तकलीफ हो ही नहीं रही है कि ये हो गया, आज ये हो गया. And overall, I think I'm a very better person. जो मैं पहले थी ना, उससे I'm living a quite better life, and as a person also I'm too much better. And I would definitely thank Dr. Manish for that and Dr. Sarkar for that. You have been an excellent doctor. You have been always very, very cooperative, very cooperative. So, and one thing I would like to share कि मेरी जो last appointment Dr. Manish के साथ थी, तो उन्होंने मुझे सामने से बोला था कि आप अभी होम्योपैथी मेडिसिन क्यों ले रहे हो, आप स्टॉप कर दो अभी मेडिसिन. So I think it is so much like I've been habituated with it since 8 years. There is not a single day that I've not taken the medicine. So मैंने बोला ये मेरा भरोसा निकल जाएगा, आप कंटिन्यू ही करो, मुझे स्टॉप नहीं करना है. So still I'm continuing with that. And one thing is that I've also taken cancer very positively. ये एक जो आता है कैंसर, तो I think we need to accept it. It's not in our hands कि ये मुझे क्यों आया, ये क्यों हुआ. That all questions has to take an end, and you have to take it very positively. Yes, it has come, so now I have to fight with it. And actually not fighting it, I've merged with it. I can say that it is within me and it is a part of me, and we have to live together. The cancer cells and myself, we have to live together. That is the thing I think I have accepted. So things are working out very nicely. But the major role that has played, that is homeopathy, the others from Dr. Manish and Dr. Sarkar. I'm very, very, very thankful to all of you. And whenever we meet cancer patients, that my husband has also so much faith in it. कि कहीं पे भी हम जाते हैं तो we come to know that this is a cancer patient, कि उनको ये सब treatment चल रहा है. तो we always make a point कि उन लोग को हम कहते हैं कि आप होम्योपैथी मेडिसिन साथ में चालू करो, उसका बहुत ही अच्छा असर होगा. We always tell them, and maybe many of them must have been benefited from that. So thank you, Dr. Manish, very much.
So thank you, and it
Okay.
was very nice words that you said. And the best thing I liked about you is let the cancer cells live in with my normal cells. Why can't that happen? And if we can get to that acceptance, and as I was talking, let's become more natural therapies, put natural therapies inside us, and get all other chemicals out of it. So homeopathy can be a big support, and so we are really happy to see you like this live, and God bless you. And of course, we are always there whenever you need or any help. Thank you. Thank you.
Okay. Thank you.
So let's go to the another patient. We have got Usha Anokar. Amol, are you there? नमस्कार.
नमस्कार सर.
तो उषा जी, आप अपने लैंग्वेज में बात करिए, हिंदी मराठी जो आपको चाहिए. एंड आपका अनुभव, मुझे लगता है मैं आपको सिर्फ अभी दिवाली में ही एक बार इन पर्सन मिला हूँ, जब से हमारा ट्रीटमेंट है.
बहुत अच्छा लगा था आप मिले तो.
और हमने सब वीडियो कॉल पे ट्रीटमेंट करी, क्योंकि फिर कोविड आ गया और ये आ गया वगैरह वगैरह.
हाँ सर.
तो आप अपना अनुभव शेयर करिए लोगों के साथ. कि
हिंदी में करती हूँ मैं.
एकदम हिंदी में करिए, कोई दिक्कत
थोड़ा
नहीं.
लिख के रखा है, वो आपको पढ़ के सुनाती हूँ.
श्योर.
नमस्ते सर, मैं उषा अनोकर पुणे से बात कर रही हूँ. मैं लगभग 5 साल से कैंसर से लड़ाई लड़ रही हूँ. मार्च 2018 में कैंसर डिटेक्ट हुआ था मुझे. ओरियन कैंसर हुआ था ऐसा पता चला. सबसे पहले पेट में पानी जमा हुआ था, वह निकालने के बाद सीटी स्कैन, बायोप्सी कराई गई. उसके बाद कीमोथेरेपी का सिलसिला शुरू हुआ सर. 3 कीमो के साइकिल के बाद ऑपरेशन द्वारा ओवरीज निकाल दी गई. फिर 21 दिन बाद कीमोथेरेपी फिर शुरू हो गई. यह सब करीब 1 साल तक चला. कीमो के साइड इफेक्ट बहुत हुए और वो मैं झेलती रही. इसके बाद सब ठीक हुआ और हम लोग, मैं और मेरा पूरा परिवार खुश हुए कि चलो सब अच्छा हो गया है. लेकिन ये खुशी हमारी 4 महीने ही टिकी. फिर से CA-125 चेकअप किया सर, तो वो बढ़कर आया. इस कारण फिर से कीमोथेरेपी शुरू करनी पड़ी. उसके सिवा दूसरा मार्ग ही नहीं था. इस दौरान अब कीमो सहन नहीं हो रहे थे और भयंकर तकलीफ होने लगी. मैं तो रोती थी और ये देख के सब मेरा पूरा परिवार परेशान हो जाता था. परंतु कीमोथेरेपी लेना जरूरी हो गया था. बहुत तकलीफ होने से मेरे मन में होम्योपैथी की दवाई शुरू करने की इच्छा हुई सर। 2019 में मैंने मेरे बेटे से कहा कि मुझे होम्योपैथी दवाई लेनी है। मेरे बेटे ने डॉक्टर मनीष जी यादव मुंबई से संपर्क किया। उनकी सलाह पर मैंने होम्योपैथी दवाई लेना शुरू।
एक मिनट उषा जी, आप म्यूट हो गए हो। एक मिनट उषा जी, आप म्यूट हो गए। एक मिनट। हाँ प्लीज।
डॉक्टर मनीष जी ने मुझसे बहुत शांति से बात की और मेरी पूरी प्रॉब्लम ठीक से समझ ली। मुझे क्या क्या तकलीफ है, कब कैसे क्या क्या होता है, सब सुन लिया। उनकी बात करने के तरीके से मेरी आधी बीमारी गायब हो गई, ऐसा मुझे महसूस हुआ। डॉक्टर साहब ने उनकी दवाई देना शुरू किया और मुझे होने वाली सब तकलीफें धीरे धीरे कम हो गई। कीमो के कारण नौसिया, उल्टी, एसिडिटी, मुंह में कड़वापन, भूख प्यास न लगना, ये परेशानी शुरू हुई थी और उस कारण मैं बहुत परेशान रहती थी। लेकिन डॉक्टर साहब की दवाइयों ने ऐसा जादू किया कि ये सब तकलीफ दूर हुई और मैं शांति से जीवन जी रही हूँ। लगभग 4 साल से मैं डॉक्टर साहब की दवाई ले रही हूँ, साथ में एलोपैथी की दवा भी ले रही हूँ और पहले जैसी हंसी खुशी जिंदगी में जी पाऊंगी। इस सब के लिए मैं डॉक्टर मनीष जी की बहुत बहुत आभारी हूँ।
बहुत बहुत शुक्रिया उषा जी। और आपको बैठा हुआ देख मेरे को बहुत अच्छा लग रहा है, क्योंकि मैंने आज तक हमेशा आपको लेटे हुए देखा है।
हाँ सर, नहीं दवा भी थोड़ा ठीक लग रहा है सर, और अच्छा मतलब दवाई
गुड
अच्छा
गुड।
काम कर रही है आपकी।
आपका वेट भी बढ़ा हुआ लग रहा है मुझे थोड़ा।
हाँ थोड़ा बढ़ गया है।
वेरी गुड। वेट बढ़ना अच्छी बात है।
वेट बढ़ गया है, मतलब सप्ताह 57 पर गया था, अभी 64 हो गया सर।
वेरी नाइस, वेरी नाइस।
भूख भी लगती है, खाना भी ठीक से जाता है।
देखिए क्या है ना कि हम हमेशा जब कैंसर आता है तो हम हमेशा डेथ से उसको कनेक्ट करते हैं, राइट। तो ऐसा नहीं, ऐसा एक चीज कहा गया है कि व्हाट कितना लंबा आप जीते हो इम्पोर्टेंट नहीं है, कितना अच्छा आप जीते हो वो इम्पोर्टेंट है।
हाँ
तो अगर हम ये चीज अचीव कर लें विद एनी थेरेपी, आई थिंक दैट इज वन ऑफ द, वो एक बहुत अच्छी चीज है। तो बट आपका भी दाद देना पड़ेगा उषा जी, आप भी एक फाइटर हो और आपने इस कैंसर पे जो आप जीत रहे हो, जो फाइट कर रहे हो, क्योंकि ये बोलना लाइक मैं दवाई दे रहा हूँ, मैं पेशेंट देख रहा हूँ, बट मुझे दर्द का एहसास नहीं है ना, क्योंकि दर्द आपको होता है, तकलीफ आपको होती है। हालांकि मैं एम्पैथाइज कर सकता हूँ, बाकी लोग देख सकते हैं, बट जिसको ये तकलीफ होती है जब वो झेलता है वो चीज को, वो सफरिंग बहुत पीड़ादायक होती है। तो
पीड़ा तो
आपने
बहुत होती है सर।
तो आपने उसको लड़ा है और इसी स्ट्रॉन्ग विल को बनाए रखिए। हम हमेशा आपके साथ हैं।
मैं
और
आपके भी साथ में, मेरा परिवार पूरा मेरे साथ में, और
यस
आपका दवाई से और आपसे बात करने से मुझे बहुत अच्छा लगता है सर।
यस, एंड हम इस पे जरूर जीतेंगे, जीत पाएंगे।
जीत पाएंगे सर, ये लड़ाई जीत जाएंगे, ऐसे लगता है मुझे भी।
यस डेफिनेटली। बहुत 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 शुक्रिया आपका। थैंक यू, आपने टाइम निकाल के आए आप, वेरी गुड, थैंक यू।
सर, थैंक यू।
Wow, it is so exciting, I was very apprehensive about this session. I don't know how it's going to go, but these patients, I will not call them patients, these are cancer warriors actually. So many people are going to listen to you. Itne sare log, so many people are going to listen to you, and in coming future also, you are going to be a role model and a hope for this dying community. So now I would like to go to Swati Rane ji. Swati ji, are you available?
Hello. Hi.
Yeah, Swati ji.
Okay. Good morning to all. And I'm very happy and satisfied mother to be here. And being a nurse myself and into healthcare for almost 20 years, I have seen cancer patients from my training period actually. But that time cancer was not so much understood what we understand today. So I think homeopathy has given me a new vision, I can say. And my daughter was diagnosed with a very rare cancer when she was almost around 6 to 7 years old. And she underwent all the treatments at Tata Cancer Hospital. The doctors were very good, but they were not so clear because the disease was not clear to them. So they were trying their level best, but she got cured for almost 3 months, and again, she we saw that it is repeating, and that was the time I took a call as a mother that I want that she should be happy. Okay, instead of a treatment which is not going to make her happy, I want a treatment which will make her happy. Otherwise, I don't want the treatment. And that's how we came across Dr. Manish and Dr. Sarkar. And in fact, when I came, because I'm from allopathy, I really didn't have that much of hope because everything was over, by the time I came to them. And I saw these two people, and they were so humble that again that hope, started. And more than me, my daughter was very happy being with both the doctors and their team, because they were so humble and they could connect with her. And what I can tell you, that I'm happy that I came across cancer, because it changed me as a mother and it changed us as parents and my daughter, because I felt now that it is more of an emotional disease than actually a disease. Okay. And our lifestyle, what he mentioned, lifestyle, diet, emotions, I think these causes we had taken for granted in our life, So I think as parents, we have to see that, our child, how much physical health we look, we have to take care of the child's emotional health also. And the most important thing is that as parents, you should not be stressed. You should not live a stressful life, because that stress goes to your children indirectly. So that is what I learned. And what I learned is that medicinal is a minuscule. It is 10% of the cure after taking the medications from Dr. Manish. Because every time you would tell me that you don't worry, that was his more you just follow the things, it will get. And now, and by the end, when she was completely cured, almost for 2 years we were checking, and she was completely, he told us, now you have to stop the medications. And I was, as a mother, I was not ready for it, because somewhere, I had that thing, no medications is necessary for her. And he told me, no, she's completely cured. And my daughter told me, I don't want anything. So that was the most important thing. So when the doctor and the daughter is telling, then why I should be like a hindrance, no? But as a mother, I was so deciding to give her something preventive. So, and then my daughter, I'm not going to take. And then he's saying, I'm not going to give. And that was that time I realized that medicine is just what you say. I feel that is a minuscule thing. The most important is the trust in the doctor and trust in yourself, in your own body, because your body has such good mechanism, such good intelligence, that it can cure. Like what he said, that body knows how to cure, but we need the support of the doctor. And the most important thing, what I can tell you here, is that I started believing in homeopathy because I started reading on homeopathy. I didn't have a blind belief. And I realized that they are treating the emotional factors first, and they're treating in the holistic way. They're not treating only a part. So I think that is what I think is the success of homeopathy, which because even whenever I call Dr. Manish, even for my cough, cold, now we are as he rightly said, now he's a family doctor for us. So my parents, my sisters, my friends, everybody knows Dr. Manish. So he's our family friend now. So then a doctor. And what I realized is that, that acute thing, it is actually acute medicine. Homeopathy is acute medicine for acute disease, because I'm telling you, you don't require any other medicine if you have this medications, what Dr. Manish will tell you. And he has given us a kit, which I take it every time. And we have really managed acute things in my family, for my parents, for me, for my daughter, very nicely. So it is not a chronic disease ke liye you have to go for homeopathy. Even your acute diseases can be managed. And have faith in your doctor and in homeopathy, and spread that. That much I can tell. Thank you so much.
So thank you, Swati. There were some few very good things that you said. Na? You said about the intelligence. The body has its own intelligence. So what we need is that we need a therapy or help or whatever to
Yes, very
enhance
much.
this intelligence. And their
Yes,
homeopathic medicines really are very effective. And
fantastic.
another point is acutes, which I want to again emphasize. If you ask me, in my last, whatever years I have been working on with, forget cancer, even in other chronic cases, I have realized that acute is the moment when the remedy understanding is better, and acute gives, like body gives acute, so that you can diagnose the disease and you can give proper medicine. And homeopathy is slow. This is a misnomer. It's not slow. It works miraculously if the patient
It is
has little
miraculous.
faith and
Yes.
they connect properly.
No,
So
homeopathy is miraculous, and most important thing is the way it is executed also. Okay, not all homeopathic doctors have same results, as you very well know. So it is also very important to get the right doctor to diagnose it properly. So that is also very important, I feel. And I think Other Song has a beautiful team. And I think we were fortunate to have Dr. Manish and Dr. Sarkar. Thank you so much.
thank you very much, Swadiji. Your words will be inspiring so many people and so many mothers, whose children are, it's a very big agony. So they will be inspiring, and you are like a hope. Your family is like a hope for so many generations to come. So thank
Yes.
you for being there.
Thank you.
Thank you.
Thank you.
Thank you.
Thank you. Bye-bye.
And now, bye bye. So what homeopathy is to offer, like in what sense you feel that homeopathy is offered? The first thing that we have to understand, homeopathy can be an adjuvant therapy. It's a very important remedy. As you must be thinking, that so many patients with chemo, radiation, you can't stop everything, right? And it's not judicious to give a judgment and stop things. It is a patient decision and doctor's decision. But even after taking those treatments, the lifestyle and the way people live and the side effects are there so bad. So as an adjuvant therapy, slowly and steadily, homeopathy can be a really part of that. Palliations. Today we are here showing you cured cases, but I'll tell you, frankly speaking, we are not here to boost ourselves. We are not here to say that homeopathy can do everything in cancer. No, we are not here to say that. There are many cases which in my hand I have lost. But yes, palliation, when you say, because it depends on the stage that he comes. If ultimate stage patient comes, palliation is the one thing uh, which doctors want to achieve. Even in chemotherapy, they write down palliative chemotherapy. And homeopathic science can become a very important point in that, where beautiful palliations we have been able to manage. And even if the patient leaves us, he leaves without the agony. Homeopathy can help you, as the patients you might have heard, maintaining the lifestyle. So changes that they do and the lifestyle, the better lifestyle that they can have is through homeopathic medicines. And of course, ultimately, building immunity. It's not just curing cancer, because cancer is like a disease, like other diseases are there. Okay. So disease has to be cured, but the most important thing, the body has to become strong enough. So building up of immunity, if your immunity is stronger, I think this word after COVID has been, very common and people know about it. So in building immunity, homeopathy works really well. So it is not just cancer or big diseases, but even in cold, cough, fever, typhoid, thyroid, any diseases, if you have, if you take proper consultation with any homeopathic doctor around you, definitely your immunity will be built and you can fight the disease better. And yes, cure, of course, we want to cure. You have seen some of cures here. Our ultimate goal is to cure, and that's the effort, and we are totally committed towards it, so that we can slowly and steadily move towards the cure rate. What are we looking out for when the patient comes? As we talked about, there is a definite cause. There is a definite cause, and that cause, if you ask me what I do in that, with my patients, I go back and back and back and back and find out the cause. There are some nuances happen, maybe at emotional trauma, maybe at general level, maybe the drugs taken, maybe the genetics. There are so many things in the background, maybe the stress, the lifestyle that people have, they have been taking. These factors are affecting, and that's how the disease sometimes they trigger. So in homeopathy, we try to find out the cause and we deal with it. And the last and the important thing which we need to understand is individualization. This is a word that you will find in homeopathy, and this is, you can say that it is a base of homeopathic practice. What is individualization? The crowd that you're seeing, this is a crowd. Suppose they suffer from one disease. Suppose everybody suffers from a cancer rectum, everybody. But everybody will receive a different remedy. That is homeopathy. So if somebody is claiming that we have got specifics, we have got some combination, we have got some tablets, if you have this disease, take this tablet, this disease, then take this tablet, these people are fooling you, especially when I'm talking about homeopathic practice. In homeopathy, there cannot be specific medicines. The medicine is not for disease, but the individual. So 10 people come for headaches, 10 people will receive different medicine. And there is the art. And here is the art of a physician and the beautiful science combining together. And that's what we focus. We try to find out individualistic characteristic that everybody works in and how they react to the surrounding and what symptoms develop. So let us stop here. Do we have Jiten? Otherwise, we can stop. Okay. So I'm done with my session, and today's session was actually to showcase that yes, there's a hope. There's hope in homeopathy. Homeopathy can be adjunct therapy or even the mainstream sometimes, and give a lot of hope to the patients who are suffering with this formidable and diseases. So here I would like to thank the entire Other Song team, Dr. Shazia for hosting, creating a platform, and also all the patients, all my cancer survivors who have come here and given so much hope to the world that yes, this formidable disease is not to just fear. We together can fight back. So I'm done with it, Dr. Shazia. If there are any questions, we can take it. Otherwise, we can stop.
Yes, Dr. Manish. Thank you so much for this. I hope everyone has enjoyed this amazing presentation. It definitely has given me a lot of hope. So we don't have much questions except this one participant wanted to know why only milk. There was milk that was advised in a lot of cases. So if you could address a little bit more about the diet part of it.
So basically, there are three things that you have to stop in cancer patient. One is sugar. When we say sugar, means white sugar. Okay, white sugar that we take in the tea, because that is the most dreaded thing. In fact, we all should stop sugar, white sugar. You can take sugar items, you can take jaggery or organic sugar, that's okay. But white sugar has to be stopped. Second is non-veg, because this creates a lot of toxicity. So non-veg, I strictly want my patients to stop it. Okay, come on natural diet and vegetarian diet more. And another thing which I talked about, milk. Now, why milk? As per my understanding about milk is, see, if you have a cow in front of your house and you are giving, if you are giving, like you're taking care of it and you are milking it, then you drink milk. Milk is good. But if you're getting milk from some other source, how can you say that injections are not put into that? How can you say that, um, oxytocin injections or other milk producing injections or the fertilizers that, the kind of food that the cows are drinking, how can you say that it is not given? So the hormones that are being given to the cattle, okay, the cows and the buffaloes, the injections that have been given, the hormones that have been given, those hormones can get carried in the milk, and those milk we are drinking. And especially I have seen that in females it is quite disturbing. Why? Because females have a lot of emotions, a lot of hormonal changes more than men. So milk, when taken, lot of milk is there taken. So this is one reason, because we want to avoid toxins can come, the hormones. In fact, not only stopping here, I want to go ahead and tell you that even hormone tablets, I don't prefer my patients to take any tablets like, estrogen, progesterone for menses or whatever, contraceptive pills. These are, this could be one of the factors which can, hinder the progress, or maybe, sometime it could become one of the cause. And that's the reason why milk is stopped. I hope you get the answer.
Yes, Dr. Manish, thank you so much for answering that. And so that concludes the webinar. Thank you all for attending. Hope you have enjoyed this presentations. So for any further queries, So if you have any other queries, you can write to us. You can even WhatsApp us on this clinic number that is there on the screen. We are always available for you. And or if there's any other personal question for Dr. Manish, you could always write to him as well.